Okay, it looks like a good number of people have joined. So again, welcome to our session, getting started with ABA therapy credentialing now. Thanks so much for joining today. I'm your host, Amber Zooberg. A little about me, I've been in the ABA field since 2006, and I've provided services in a variety of settings, including in-home, center-based, and both private and public schools. I've been a BCBA for the past 13 years, and after becoming certified, I decided to start my own practice, and I'm excited to share some of my personal experience with you today. Before we dive in, there's just a few housekeeping items to cover quickly. During your presentation, you can use the Q&A button at the bottom of your Zoom menu. I'll be answering as many questions as time allows at the end of the presentation. The chat feature is disabled, so please direct all your questions to the Q&A button. Also, this webinar will be recorded and sent to you for playback within 2 to 3 business days, just in case you miss anything or want to review something we discussed during the session. And as a reminder, that information in this presentation is based on my experience and does not constitute legal advice. Any legal decision should always be discussed with your attorney. All right, today's agenda, we're going to go over process, terminology, preparation, paperwork, and some resources. Right, so let's dive in. Credentialing is a huge hurdle to start ABA practice, and it poses challenges for everyone. For ABA providers, credentialing and delineating quality and competency stems from a desire to protect both consumers and the profession itself from anyone who may be practicing under the name Behavioral Analytics Services, but implementing it incorrectly. So keeping this in mind, each insurance provider requires you to meet certain criteria and submit forms specific to their requirements. The purpose of this webinar is to give you some context to the process and provide guidance to help you accomplish this more efficiently. Before you begin, so the first step is to outline your process and gather all your required documents before you start. And I know it can be tempting to try to figure things out as you go along, but you'll greatly benefit from having it all together ahead of time. So something we've discussed in a previous webinar, you want to determine your scope of practice. This can include the age groups you'll work with, the time of day and locations practicing, any special focuses like increased parent training or social skills groups. Those are little bits of information that you will be asked during your credentialing process, especially your areas of specialty. Choose who you want to credential with. Take a look online at payer websites. Most have a provider section with information on what's needed to credential with them. And not all insurances will be accepting new providers. Some of the larger ones, I know sometimes Blue Cross Blue Shield is not accepting providers in certain areas. So if that's the case, you can sometimes enter single case agreements if you have a client that you want to work with those providers that aren't accepting new providers. And you can continue to check back to see when they might be accepting. Collect the basic paperwork that we're going to review and make sure your CAQH profile is updated and attested. And we'll get into CAQH in a little bit. And finally, I recommend keeping everything together with a timeline of when you applied for each insurance and what you submitted. This will make it easy for you to reference back to this later to get a better idea of when you need to follow up with each payer, and you can make any notes. Definitely, if you ever call in, make sure you ask for a call number to reference in the future. That way you can refer back to that as well. Right, so while you're gathering documents, there's a few key terms you should be familiar with. Credentialing and contracting. So the process of credentialing, sometimes referred to as provider enrollment, consists of 2 phases, credentialing and contracting. Credentialing is the process that insurance companies use to verify your education, training, and professional experience. And this ensures that you meet their requirements for participating in their network. This is done through CAQH most often, and we'll discuss that more in a moment. And remember, you'll need to credential each employee so they're associated with your contract. So this can be an extra step later on outside the initial credentialing process if you bring on new providers as you grow. The contracting phase is where the company issues you a participating provider agreement or a contract that's going to define the terms of your in-network participation, including approved services and agreed rates for those services. Remember, you don't have to do everything at once. If there's a main payer in your area, it might be easier for you to start with one payer in addition to offering private pay while you familiarize yourself with the process. You can kind of take it one by one if you like, or kind of stagger who you start to apply with, just to make things a little easier for you while you're getting familiar with everything. For me personally, TRICARE was the main payer in my area, so I credentialed with them first because I was in a heavy military area. But credentialing with one payer can have its disadvantages if you run into any problems that can delay payments. So just something to keep in mind there. So a few other terms you'll hear throughout the process: payer, which is the insurance carrier credentialing with; group versus individual NPI. You're going to have two NPI numbers once you establish your practice. Your type 1 is your personal NPI, and your type 2 NPI is your business NPI. You're going to need both to submit claims for insurance. One's going to identify your group practice, and the other to bill under as the BCBA that's supervising the work. If you haven't already done so, you can apply for your NPI on the NPPES website. Your billing address, you'll be asked this a lot. This is ideally your permanent billing address where you want all your benefits mailed. Your pay to address, if you have center-based services and you don't want to receive mail there, you can also have a pay to address, and that's where you would receive mail for your business. Keep in mind, if you're providing center-based services, that address will need to be on the one on the claims. EFT, electronic funds transfer. You'll typically enroll an EFT with each individual payer if you want to receive electronic payments rather than a mail check. And this is where your business bank account is going to be handy. Claims. Your claim is your bill to the insurance whenever you complete your service. You're going to generate a claim that has your organization information, your provider information, your client's payer. An electronic claim submission is an 837 file that's sent to the payer, and you can submit a claim to each payer through paper if you want, or electronically in their portal, or by using a clearinghouse. So there's a few different options for you. Obviously, paper is going to be a little slower than electronically. If you're dealing with multiple payers, I would definitely recommend going through a clearinghouse, which we'll talk about. The payer portal can be easy, but they all do vary. So you would need to log into each payer portal individually if you weren't using a clearinghouse. So the clearinghouses, typically when you submit a claim, you would upload it to the payer portal for each payer. A clearinghouse kind of acts as a middleman, which allows you to upload the claims to the clearinghouse website. So you can upload claims for multiple payers in this one location, and then the clearinghouse sends those claims to each payer. Clearinghouses typically do have an associated fee, but they can be a good investment to decrease your admin time. A remittance is the explanation of reimbursement for your payer. When you submit a claim for reimbursement, they'll return a remittance, which is an ERA or an EOB. The ERA stands for an electronic remittance advice. So an ERA is a HIPAA-compliant electronic substitute for paper EOBs. So again, depending on how you're submitting things, what you signed up for, which method, you'll either get an ERA or an EOB. The ERA includes the same information as the EOB, but it's faster to generate and less prone to errors. It will include details on the patient's paid and denied medical claims, adjusted amount owed, final claim status, any reasons for denial if it was denied. So you want to make sure to read through that. For denial reasons, it would give you instructions on why it was denied, how to resubmit. Once the claim is you submit is processed, they'll send you back your ERA as an 835 file. Rates, standard and agreed rates. Your standard rates are what you'll charge for each of the services that you're going to provide. Your agreed rate is what you will be reimbursed for those services from the payer. So your agreed rates will be specific to each payer that you contract with, and a fee schedule should be provided in your contract. And then finally, service codes. They indicate what you did during an encounter, so what service you provided. The current procedural terminology, CPT codes, and the healthcare common procedure coding system make up the procedure coding system. Each service has an associated numeric or alphabetic code, such as direct instruction, parent training. These can all be found on the payer's website or in a funding source guideline to tell you exactly what the payer is going to cover for each code. Specific payers have little differences here and there, so make sure you read your contract. Sometimes you'll be required to use modifiers with your service codes when service codes are provided by someone with a different degree or level certification. So if you have a BCBA or an RBT providing services, you might have a modifier that you need to include with the code. And you may also need modifiers for services provided in different areas, such as telehealth. All right, so now that we've gone over terminology, let's start talking about some documents and action. So what's CAQH? The Council for Affordable Quality Healthcare is a nonprofit collaborative alliance of the nation's leading health plans and networks. CAQH's mission is the improvement of healthcare access and quality for patients and the reduction of administrative burden for healthcare providers and their office staff. So you want to make sure you register and set up your CAQH profile. Make sure it's set to be viewed by anyone so that multiple insurance companies can access your profile when they do process your application. CAQH profiles, they need to be reattested every 3 months. They'll email you a reminder. I've gotten multiple reminders. So they do email you frequently to remind you as you get close, but it's best to just have it on your calendar, get it done. Be specific when you fill out your information. There is some stuff that's not required, but I would be as specific as possible with, month, day, year, just to make sure you have everything a payer could want, because it will vary from payer to payer. So as I mentioned earlier, before you begin your application processing, definitely recommend contacting each insurance company you're interested in credentialing with to make sure they're accepting new companies in your area. You can usually call the number on their credentialing application to get this information. And if they're not accepting the new providers, get an estimated date on when you can check back and reapply. Once you're ready to apply, you can do so through the mail or online portals. Strongly recommend online portals if possible for faster turnaround. Take screenshots or print a PDF of each confirmation for your records, and you'll need similar information that you submit to the payers for your CAQH application. So it's great to have everything together, as well as your scope of practice and your fee schedules. So you can create your fee schedules for what you want to charge per unit, per service code. And we have a list of documents for you in our resources today. So once you've applied, make sure you follow up. It might seem a bit repetitive, but you want to call and check in on the payer portal or call every 1 to 2 weeks, probably, for a status update. Make sure there's no more required documents they're waiting for or any pending follow-up questions for you to answer. Once your credentialing with payer is complete, you can always work on negotiating the contracted rates. Not all payers will negotiate, but it never hurts to ask. If you do need to provide services before you get your contract finalized, like I said earlier, look into applying for a single case agreement. In this situation, you would apply for an authorization for an assessment and then follow up hours if they allow it with the payer. And it's a one-time basis approval until you get credentialed. This is usually only honored if you've already started the credentialing process. Some will do a one-time case agreement. Anyways, it really depends payer to payer. So it's never a bad idea to check. But they will usually give you standard rates for reimbursement or direct you to where you can find them. They really don't negotiate those. So once you get your contract, you want to make sure that you read and understand it. There's many components to a contract, so pay close attention to each one. Your contract with the payer is going to include terms of service, which may cover timely filing, making sure that you submit your claims in the accepted time frame, the deadline for which you can appeal a service decision, like a rejection or denial, and the notice period you will have to amend any documents if requirements are changed for credentialing. So if they have additional materials that they need, or staff need certain degrees, certificates, something like that. Your contract is also going to include information on which plans are covered, like HMOs, PPOs, or any Medicaid branches that they might be managing. So overall, credentialing can be intimidating and overwhelming, but it can help But, being prepared can help just ease the stress of it, and following up with many carriers, while you're getting the rest of your business situated, just continuously following up can help ease that burden. So here's a quick overview of some of the things we discussed as a reminder of what should be on your radar as you go through the credentialing and contracting process. And finally, remember you're not alone. Use your resources, ask for help, ask a lot of questions. Be sure to collect the contact names, callback numbers for anyone you speak with in case you have follow-up or additional questions. Calling insurance companies can be quite cumbersome. My personal experience, it really depends the luck of the draw on who you talk to that day. Sometimes answers vary a little bit. So, don't be afraid to be persistent and call back. Like I said, get those reference numbers to reference prior calls as well. I find some people be extremely helpful, some not as helpful. So definitely don't be afraid to call back more than once. There's also a number of communities on and off social media with networks aimed at helping ABA startups. Many people are willing to share their experience if you just reach out and ask. And don't forget about third-party companies. They can help fill in gaps if you feel, until you feel comfortable on your own. Third-party companies can help in a variety of areas, from credentialing to billing and understanding your claims. The downside is they can be expensive, so you do want to make sure you're vetting them to ensure they have experience in your scope and area. Sometimes if you don't want to invest long-term in the funds, it could be beneficial to find someone that will help you really walk with you hands-on through the billing process so you can familiarize yourself and then maybe start to fade out their services once you're more confident in the process. And then additionally, we're going to be sending you a credentialing checklist resource to get you started and help stay on track. And if you aren't familiar with CR Essentials, it is an all-in-one software solution designed for startup and small ABA providers. CR Essentials integrates practice management and data collection to help streamline the process from beginning to end, providing the optimal client experience. And it's fast and easy to get started with personalized support and help. It also is something, if it might interest you, we have a free trial option where you can use the product until you onboard your first client. So we're going to take some time for questions. So let's take a look and see what we've got. So one of our questions about how to access the mentioned resources, we will be sending those out along with the recording after the webinar, usually in about 2 to 3 business days. Another question I had come in. What's the difference between billed or standard rates and agreed rates? So your standard rates are rates that you are going to charge across the board. It's the same for all payers, private pay, different payers. That is your standard rate for this service. So you don't want to, say my rate is, $20 for you, $40 for you. You have a standard rate for each different service across the board. And then you have your agreed rate, which is what you agree with the payer to take. So that might be, typically it's less than your standard rate, but that's what you've agreed with the payer and negotiated upon when you decided to become in network. Great question. Okay. Does a company need its own CAQH, or is the BCBA's CAQH used? So if you are the one, the main BCBA there, and it's your company, you only need the one CAQH. I believe that's correct. I would have to check back with that on you, but I'm pretty positive whenever I started the process, I only had mine that I went through. I do think you list your name, your company's name there, and then they credential you as the BCBA under there. If you have an owner that's not a BCBA, you are still credentialing, but then you have all your individual employees that need a credential as well. So each employee would have their own CAQH account. Are nonprofit companies able to provide services? Absolutely. So that would be kind of a legal accounting question, but how you register and create your company is really up to you. There's many different ways to structure your company. for tax purposes. Can you explain the difference between individual and group contracts agreements? So the individual, I'm not sure if you're talking here about the single case. I don't think you're talking about single case. I think you just mean an individual person, and groups as a company. So an individual person, you know, before I formed an organization for myself, I was contracted with payers as an individual, just as Amber Zooberg, credentialed with them as an independent BCBA. When I formed a company, even when it was just myself, I was underneath the company. So the company was credentialed in a group contract with the payer, and then I was listed as an employee underneath it. The credentialing process was a little faster when I added myself as an employee because I had already been priorly credentialed as an individual, but that's kind of the difference there. So you can have single individuals credentialed with the payer, and then you have people that are individuals contracted under the group contract under your company. I hope that answers your question. In my state, Medicaid requires that you do not charge any other payer less than them. How does that apply to accepted rate? So again, check with your attorney just in case I'm wrong here, but I think what you're interpreting here is them discussing your standard rate. So your standard rate, like I said, needs to be the same across the board, which is why it's called a standard rate. So you have your standard rate of this is what we charge for direct services. We charge the same for everyone, but we have agreed to take this amount less from these specific payers. So your agreed rate is going to vary from payer to payer, but your standard rate is consistent. If you have a signed contract with an insurance company, can you still negotiate the fee schedule? Again, varies payer to payer. You certainly can. It's less likely they will negotiate with you. There are some standard payers like Medicaid, you know, the government ones, Medicaid, TRICARE, they don't negotiate. They have their standard set rates, depending on, you know, where you're at. I would, you know, look at the contract, reach out to the contracting department, and then you can talk to them about negotiating and see what your options are there. But I do know, you know, sometimes there's like that renewal period where that's usually a good time to try to negotiate. Kind of similar question, which insurance department do you typically contact to negotiate payroll rates at the time of renewals? Again, it would be the contracting credentialing department, varies from payer to payer. You kind of have to ask around, and you just want to talk to whomever is managing your contract at the time. Some of the payers do have like case advisors. I started an LLC company with no employees yet. Do I need a group NPI if I'm a sole proprietor? I personally did have a group NPI because it is a company, and then I had a personal NPI. Again, I would check to make sure because I'm not sure about the whole legal tax situation of it all. But even as a sole proprietor, to my knowledge, you're still underneath a company name, so to speak. So you would need that group NPI when you're operating as a company, especially whenever you're credentialing. They always ask for that. But again, I would check with your accountant or an attorney. You could probably also call the NPPES line and ask them as well. Does it cost money to have a contract with the insurance company? No, it does not. Okay. I believe those are all the questions that we have time for today. So if I missed any questions, we will certainly follow up after the webinar. Thank you for all the questions. Those are fantastic questions. And again, you know, if we didn't get time to address, we will follow up with you individually after the webinar. So thanks for joining. We hope to see you in our next episode. We'll be sending that post-webinar email that includes a survey. And in a few days, you will also get the credentialing checklist, as well as a link to our recording. So thanks again, and I look forward to seeing you next time.